This is Mia. Mia's been a patient in our office for the last 7 months. Her mom brought her in to see me about a week after she had given birth for torticollis. Torticollis is when you have a stiff neck, and what happens with babies coming out of the normal birth canal is that from all the twisting and turning and pulling, sometimes the baby's necks can go out of alignment and the muscles can go into spasm, then giving them more of a stiff neck. And what happens with that is that their head can be misformed and they can have issues later in life with their cervical spine. So it's very important for babies to be checked right after birth to make sure that there's no issues with their cervical spine. So Mia comes in now once a month to us. She comes in and we just check her. We make sure that everything's aligned like it needs to be. And for her cervical spine, she's able to turn her head now in normal positioning. It's okay. And then we want to make sure that the muscles are now more loose than what they were before. So she's turning her head in normal positions now, and she's been doing great with treatment. So mom just brings her in now, just once a month on a normal maintenance for us to just check her out. And Mia doesn't get any ear infections. She has been very healthy. Her immune system has been boosted from being adjusted, and she's done very well with chiropractic care. And she, most of the time, enjoys treatment here in the office, and she's been doing great. At Tri-County Chiropractic of Douglassville, we specialize in pediatric care as well as adult care. With pediatrics, it's extremely important for children to be checked when they're first born. Ethan has presented today to the office with his first visit here. His mom brought him in just to be checked to make sure he's in alignment and that there's no imbalances in his spine. Adjustments for babies are very gentle. There's nothing that is harmful to them. We make sure we check out their hip joints, that everything is moving and gliding like it needs to. We check their leg length to make sure there's no short leg, which is extremely important. When babies are first born, there's a lot of trauma to their little bodies from being, coming out of the womb and coming out of mom, and their, doctors, tugging them around. So it's extremely important for them just to be checked to make sure everything's aligned properly. A lot of parents bring their kids to chiropractors because they heard they've done so well with ear infections. And studies have shown that children with ear infections do very well with chiropractic care. Ear infections in children typically come from the upper cervical spine, and it doesn't allow the tubes to drain the fluid out of the ear, so babies get a buildup of fluid, and then that causes ear infection. So we always want to check their upper cervical spine to make sure there's no subluxation or misalignment of the vertebrae there. So again, we see children all day long here in the office in Douglassville, and we love seeing them here. So Ethan feels great to me. Nothing going on out of the ordinary. Yeah. Also, parents tend to notice that their children have a boosted immune system and get sick less frequently, and that's extremely important. My own children have never been on an antibiotic for a cold. When they complain of a sickness or not feeling well or having a fever, I adjust them, and they do very well with care, and they have never needed an antibiotic. So it's something that we want to avoid, but if we need an antibiotic, it's not a big deal to have to take one when needed. But if we can prevent that, that is our entire goal. And the adjustments for babies are very tiny, very little motion and force needs to go into the joint in order to move it. Good job. Mason comes into the office on a monthly basis as well. He comes in for ear infections. When he was about a month or two old, his mom noticed that he had an ear infection. She brought him to the medical doctor, and the medical doctor wanted to put him on an antibiotic. So she had read up on chiropractic, and she had read such tremendous research that chiropractic and kids with ear infections show great results. So he has been coming in. He did not need to go on an antibiotic. He has not had an ear infection since that first time. That went away. And now he's walking a lot, so he's falling a lot as well. So we want to make sure that Mason doesn't have any misalignments from walking around and from falling. So his mom brings him in once a month for treatment, just to make sure everything's aligned properly. And he has not been sick either, so his immune system has been boosted, and he's been doing tremendous with care. So let's just check this neck out. Very good, Mason. Very good. Excellent. And we do a lot of stretching of the legs and the pelvis in order to keep everything nice and loose in his low back. Good job. And Mason loves getting treated. He enjoys and lays there for us so we can work on his back and the muscles and make sure he's in alignment. Good job, Mason.